Time for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave. Good morning, everybody.
Well, you're going to have to help us out here a little bit because I'm not versed all that well when it comes to talking about a metabolic approach to medicine.
Yes, it is. Right now you hear about so much about the carnivore diet and intermittent fasting and kind of what is all that about? And so is it good for me? And so it was pretty interesting is that over the years we've really gotten carbohydrate heavy, and that's sugar, having a huge sugar load essentially. And then our body wants to go and store that pretty quickly to fat. And then that fat can create this metabolic stress on the body. It's inflammatory. It can increase your risk for cancers, diabetes, those kinds of things. And so what we're finding is we're just, a lot of the foods we're eating, the processed foods, the high glycemic index foods, the stuff like that our body doesn't, it's too easy for it to break down in some cases, and then it goes right to sugar. And so that's where it plays into this whole metabolic approach. So a lot of times, even when it comes to folks with a diagnosis of something like a diabetes, they think that's a condition that is set in for life, and it doesn't have to be in many cases. And that's the way I used to think as well. But there from a metabolic perspective, if you get your body into a state of ketosis, where it's burning proteins and burning fats instead of carbohydrates as a fuel source, your body tends to really, really thrive in many cases with this kind of plan. Now, you have to seek a medical professional and walk through this because there's some little intricacies to it, but it's very doable, and if it's right for you, it can help with a lot of chronic inflammatory conditions. So what we see from an evolutionary perspective is that the mitochondria over time, and especially in cancer and in many other diseases, gets damaged, and the mitochondria is what makes our energy or our ATP. And so what can we do to help that mitochondria thrive? Well, it tends to be if we get into more of this ketotic state, and this is the case many times with cancers, we want to starve the cancer of its fuel source. And what's its fuel source? It doesn't like oxygen very much. And so many times, if we can get into this ketotic state, we add some hyperbaric therapy, and that's a great other approach as an adjunctive therapy to think about. But in addition to that, over time, these cancer cells have adapted to be in the state where they just focus on one thing, growth. And the growth is tied to sugar. So it makes sense then if you get rid of the two big sources are glutamine and glucose for these cancer cells. If we start to work on limiting those or starving those and getting into this ketotic state, there's a machine called a Keto Mojo that you can measure your glucose to ketone ratio. And if you're battling cancer, in some cases, of course, you want to talk to your doctor about this, but getting into that 2 and under state has been very helpful for many folks to starve that cancer, that tumor. And then you start to look at all the other adjunctive approaches with it, with hyperbaric therapy at the right time and right place when used appropriately, the right supplements. But again, most times, whether it's diabetes or any other metabolic disorder or inflammation or a cancer, we automatically think immediately chemo, radiation, sometimes surgery. And sometimes if you can hit this from a metabolic approach to start with, if you catch the stuff early on or any stage in the game, if you decide you want to go the chemo radiation route, it can reduce the amount of therapy or treatment that you may need. Now, of course, you need to be finding an oncologist that's going to kind of be in sync and kind of open to working down this approach. But yeah, if you can reduce the chemo radiation treatment and have more of a targeted therapy because you have already worked to starve those pre-malignant or malignant cells, it can be a game changer, and then you don't get as much of that toxic load with the treatments with the traditional chemo, because the traditional chemo, it's a kind of a carpet bomb, and it hits a lot of good stuff in addition to hitting the tumor cells. So all in all, it's again, remember that whatever the medical condition is or the diagnosis is, we talk about it week after week, Dave, is that there's more to the story. There's a lot of different approaches out there, and ask about it and research it, because the social media world right now and the internet is full of, and you've got to kind of course parse through what of this is good information versus I'm not so sure. So then, you certainly can talk to a trusted healthcare individual to help navigate those waters. But it's an exciting time because we have more options now than we have ever. It's absolutely mushrooming right now with the different approaches we can take to so many different conditions.
It really is. You can see that I follow a ton of medical people, and you can see the shift. And basically what you're talking about here is, so somebody that's going to undergo chemo or radiation or whatever the case might be, this metabolic approach is trying to set you up potentially to have maybe not as many treatments, but even if it is as many treatments, to try and set you up for better success.
Absolutely. So it's all about the choice that you choose what's best for you. And so some people will say, I want to go completely holistic, and that's okay. If you want to go holistic and not do any chemo, radiation, go down that road. That's your choice. Mm-hmm. But you want to know the other ways too. So again, many folks will choose to say, well, I want to do a mixture. I want to do a little bit of both, which you just talked about, or some folks will just completely go traditional, that's fine too if that is what you think is best for you, and you've researched and know that, okay, yep. And the one thing, I followed a doc up in northern Minnesota for a while, and he said, no matter what you choose, go into it with lots of belief in mm-hmm. it, and so the attitude matters. So you want to go into it with believing that the therapy that you're going to use is going to be working for you, because the body does have a tremendous capacity to heal. And when you set your intention and your mind into that state, there are actual scientific studies that confirm that makes a significant difference. So,
and that
yeah, go ahead, Dave.
I was just going to say, and that doesn't matter whether it's cancer, diabetes, recovering from knee surgery, maybe trying to get yourself off certain prescriptions, whatever the case might be. Again, as you mentioned, it is scientifically proven. Attitude makes a huge difference in how you undertake your treatment and what you're trying to get done. Absolutely.
Attitude is huge. Attitude, love, and gratitude every day, know, mm-hmm. and so that's healthy for the bodies. We do much better when we're in that space. So, one other thing I did want to give you a quick update on Sharon, our gal from South Carolina. So she continues this amazing recovery, and this I always like to kind of leave and give a little bit of a hope story every week, and her husband came out to visit with us for about 4 days last week, and now she's got an incredible family and crew. Her friend from Florida's here now to kind of be by her side. They're staying at Beds and Shed here in Spirit Lake, and she's making a 3.5 week experience here as she works on her brain healing. And like her husband, when they've been writing and journaling, and it's been dramatic. She went again with a cane when she walked in, lots of stuttering and just fragmented thought patterns and really bad fatigue. Now this last week, no cane. Her gait is really, really smooth now. And just to remind everybody, she had a car accident last February. Then off to the neurologist, told her MRI was normal. and she has had major change in her quality of life with insomnia. She can't walk, talk was diminished, and fatigue, and just not where you want to be. And so she is. We're healing that, helping that body heal the brain, giving it some hyperbaric, some oxygen, and she's working her way towards 40 hyperbaric dives over the course of her stay. So I wanted to throw that out there it's possible for so many different conditions to feel better, and when we give our body the appropriate things that it needs to get on that healing path. So it's really awesome stuff.
And this was a gal the medical community that she was dealing with told her it was all in her head.
Correct. Yep. Then just to give it some rest. So, which rest, that was an important key. But okay, well, there's a few other key components as well that the team here, it's a blessing that it's an integrative clinic that we work on things from different approaches here, and not just the hyperbarics, but nutrition and the right supplements and the right modalities at the right time. And she has made more progress in the last 2 months than she did the prior 6 months combined. So it's a wonderful thing. When she came out here, she could barely cook. She couldn't go out to the restaurant because that would just it would cause brain inflammation and cause brain fatigue. She actually went out to dinner last night, and so just a remarkable story of just where the direction she's headed. She's got 10 kids. They're all grown now. I think they adopted 6 from Ethiopia. She's an amazing gal, amazing family, and I'm just so happy for her.
That's so awesome. All right, so Dr. Meyer, people want to live well, want to get the most out of every day, and maybe they've been told their medical condition is all in their head. How do they get an appointment with you?
Yeah, just give us a call at 712-339-6024, and our team can kind of walk you through what make an appointment looks like, what's all involved. And I do discovery calls as well on Wednesdays, which are a complimentary 15-minute visit over the phone to just talk about your case and see if this is a direction that you want to head through some of the resources and options we have available through our clinic. So it's another nice way. Of course, we always say, come on, stop by. We're a very non-traditional clinic in the sense we love for you to come in and just be a part of our team and community. It should feel like your own living room. And so we can walk you through the clinic, give you a tour, and again, blessed with an amazing team on the same mission, hope and healing.
Very good. Dr. Meyer, always a pleasure. Have a great day. We'll chat again soon.
Sounds great. Thanks, Dave.
Thank you, Dr. Bradley Meyer at Okoboji Wellness Clinic. You can also go to their website at okobojiwellnessclinic.com.